The reopening measures are slowly taking place amid the coronavirus pandemic. Malls and restaurants are working again, and factories move more and more of their personnel back into the offices. However, that doesn't mean that people won't get sick anymore. On the contrary, there are now many more chances of spreading the virus even farther. To protect the employees and clients of your business, we developed ThermoControl screening stations. It is a quick and safe solution. ThermoControl measures temperature at a distance of 25 centimeters. The device is autonomous. It does not require an additional employee to conduct temperature measurements or log the results. It can measure and even recognize masked faces. All of the results are logged automatically and stored in the database. You can use the station to ensure your clients and employees access to your building automatically.
John Smith, Brombach.
The station can issue entrance passes and grant access to the building after it measured the person's temperature. If the visitor's temperature is high, a notification will be sent and a potential carrier of the virus can't access the building. ThermoControl can send SMS and messenger notifications, as well as notifications over email. Temperature measurement technologies allow businesses to ensure the safety of people and potentially save lives all over the world.
All right, folks, good afternoon, and it is certainly that time of the week. It is the Marketplace Reset and JumpStart TV, and we are live on location here on the beautiful island of St. Croix, U.S. Virgin Islands, but particularly we're on the property of the Fred Hotel. And we recently just partnered with the Fred, and we have this new program called Tasters, and we are pre-launching Tasters at the Fred today. And so today, I want to just say thank you for joining the broadcast. At 2:30 is when we're going to feature the property, the executive chef, and the food and beverage manager with my colleague Jessica Kyler from 2:30 to 3 o'clock. But now this is obviously this is the first segment of the show, and let me bring in my colleague Carolyn and Linda from the DMV. JumpStart DMV region. Ladies, good afternoon. How are you?
We are not as good as you with the tropical breeze, but we are wonderful.
Woo, we are.
You know what? I'm not even going to show you the background. You know, I'm going to spare you that. Okay. So just enjoy me now for now, and then maybe I'll give you a little treat later on with the ocean. So how you guys doing? Everything good?
We're doing great.
We're doing well. And we want to thank you for showing the commercial for our Orange ThermoControl. So as properties like the Fred Hotel and hotels, centers for hospitality, and municipalities around the world and around our country begin to open up, our machine, our solution is exactly what you're looking for. So thank you for highlighting that at the top of the hour.
Absolutely. We have some great collaborative solutions under our chain of efficacy, and certainly the ability to monitor temperature in high visible, highly traffic area. The Orange ThermoControl is a wonderful AI technology that will do the trick. All right, ladies. So who do we have today? What are we going to be talking about? Who we have today?
We're going to talk about lots of things. And, you know, we've been doing this series on health now for several weeks. And one of the populations that is very near and dear to all of us, because we're going to hopefully eventually get there, and that is our elderlies, our seniors in the United States, and in not only in our area, but all areas. Obviously, every community needs to be very attentive to what's happening to our members of society who are most vulnerable to COVID-19, most vulnerable to the current state of our healthcare system, housing in particular. And, really, we have to be mindful of needing to take care of our elders and our seniors who are struggling with all the things that we have experienced: isolation, economic parity issues, housing issues, just you name it, the gamut. And so we have an amazing guest that will have an opportunity to really talk to us about what's happening in this landscape. She is phenomenal.
Her name is Maisha Gadsden, and if you can bring Maisha in, she's got quite the resume.
Yes.
And we're going to have her tell us a little bit about herself so that you can understand why her company, Pearl, is something so special. So Maisha, welcome. It's great to see you.
Thanks for having me. Great to see you as well.
So first of all, we'd like for you to give us a little bit of your background, just kind of a high level view. You've done so many things. And the reason why they're important is because it gives you a wonderful vantage point in your new company. So can you tell us a little bit about yourself?
Sure. So after studying health policy at Stanford, I came to DC because I wanted to impact federal policy. Most of my career has been about access and affordability to healthcare and really dealing with disparities. So my first job was at Academy Health, where I worked with state and Medicaid and CHIP directors to expand coverage during a time when states were pulling back funding. And so we were helping them find creative ways to do that. I went on to be the health director for the NAACP, so really head-on dealing with disparities in the Black community as it related to 5 areas of health. I left the NAACP to get my master's of public administration and health policy and management at NYU. While there, I served as the director of mobilization for the Black AIDS Institute, really dealing with HIV and AIDS across our communities. And following that, I did a whole stint of consulting where I worked for AmFAR to make sure that syringes were covered. I worked for Amnesty International doing a lot around maternal mortality globally. I worked for the Open Society Foundation's campaign for Black male achievement, which was the precursor for President Obama's My Brother's Keeper. Wow. And most recently, I worked for CMS implementing the Affordable Care Act and worked for Secretary Sylvia Burwell at HHS as the Director for Provider and Hospital Engagement. I went on to also do that work at PhRMA, the trade association for the pharmaceutical companies. Wow. And what happened around that time was my grandmother got sick and needed care. And because of my experience in healthcare, my family turned to me. And that was when the idea for my company, Pearl Long-Term Care Solutions, was born.
Okay.
Wow, Maisha, that is, and you look like you would be like 100 years old.
I was just thinking that. I was
going to be 100. Gosh, but you look so young to have had so much packed into your actual, into everything. We are impressed, and we are very grateful that you have come on to the call today, because this is a very important topic. Literally everything that you said that you are a subject matter expert in, from policy development to healthcare affordability and accessibility, to something that we're learning just so deeply, and that is the disparities among health and vulnerable populations, brown and Black communities, just you name it. And then being able to make sure that there is accommodations of all types for seniors as they move into a need for long-term care, short-term care, acute care, and skilled nursing care facilities and or services, which are very, very, sometimes very difficult to access, expensive. But I know that your work will really support where we head from this point forward. And we're all keeping our eyes on the things that are happening in our landscape, our political landscape, that may impact that. So why don't we just dive right in?
Sure.
Okay, great.
So you mentioned Pearl Long-Term Care. Can you just give us some insight into what Pearl Long-Term Care is and how it got its name?
I like to start with the tale of two pearls. I was blessed to have two grandmothers, both named Pearl. And both of them came to need long-term care services at the sunset of their lives. Both became immobilized due to complications related to diabetes. And my dad's mom was able to get care in the comfort of her home. Her home was newer, could be outfitted to accommodate her disability. And we had a family member that was available and had some healthcare training to take care of her. When my mom's mom, my grandma Pearl, second grandma Pearl, came to need care at the end of her life, I worked with my mom and her siblings. I was the only grandchild that was allowed on the call, but because of my background in healthcare, I was able to help them navigate these really complex systems, Medicare, Medicaid, VA. And what really stuck with me is that, one, if I have all this experience in health policy and it's this hard for me to help my family navigate it, it has to be hard for millions of families across the United States and globally to do the same.
Yeah.
And I felt like, the choices that were available to us were settling choices. I don't feel like my grandmother was she was not granted the dignity at the end of her life that she deserved. And so I wanted to create a company that would change that trajectory. So Pearl Long-Term Care Solutions is creating an online bidding marketplace so that people who are looking for long-term care for themselves or for their family members can come on and search by location, their budget, whether they want a short-term or long-term stay, what type of stay, whether they're looking for independent living, assisted living, memory care, et cetera, and get to see near real-time availability of facilities and units in those facilities that are available for them to immediately book or bid on through our platform. And the platform goes a lot further than that. We are, creating a space for individuals to coordinate their care with their family members, their caregivers, their medical providers, and also have that same, make sure that gather all the information that's needed for admissions for the provider on the provider side. So really, we're focused on ease, that you can trust this platform, that we're going to be there for you every step of the way. And just the way I help my family do it manually, we're digitizing this search, selection, and booking process for everybody to make it a lot more.
Now, if you're looking at us looking down, we just want to make sure you understand.
Oh, you're writing.
Take notes, and you know why we do, and we hope and encourage our viewers and listeners to do the same, is because we know that many of us across the country are in the sandwich years, as we have said, sandwich years as parents of kids who are at least up to 26 years old, still on our insurance, but also parents who are aging or have aged and need to have a way to navigate. So tell us a little bit about how, do you have a sense, a timeline as to when your launch? This is phenomenal.
So we have a full prototype developed, and our platform is actually being built as we speak. We plan to go live in the market in Q1 of 2021. We're signing up providers to be a part of our pilot that should be at the end of the year and go into the very beginning of 2021. And so we think that we're solving on the consumer side, some particular pain points, but on the provider side, providers are having a hard time filling their beds because, particularly in this moment, as you talk about COVID-19 and the effects it's had on the economy, at the very beginning of COVID-19, long-term care facilities were the hotbed of infections. And so what that caused the industry to do is to close their doors to outside visitors, including those potential residents who are looking for that care. And so what we've seen is a precipitous drop in occupancy rates and in addition to that, revenues, because they're linked. And so on the Pearl side, we're hoping to provide and to help those providers fill those empty beds and do it in a way that keeps everyone safe. And so that's the first pilot we'll be doing, is having providers on board to our platform so the consumers can come and search for the long-term care that they need. We know that there's a huge need and demand in the market for this, because 70% of those who to the age of 65 will come to need some form of long-term care. Mm-hmm. And we're also dealing with a rapidly aging population. We like to call it the silver tsunami, and that is really the baby boomers who are coming in, who are aging into the age of needing these services. And our industry is not prepared. So we're trying to provide those solutions so that everyone who needs the care can get it.
So it sounds like you're also doing a lot of research and forecasting. So to educate the consumer market, that means the families, the providers, and even the individuals who are going to be serving at the bedside to understand workforce development and educational opportunities, because these are going to be gap industries. And that's what we're seeing right now. So you made a very good point regarding a couple of things, because we're in the baby boomer. So hopefully we can stay in our house just a little longer.
Yeah, exactly.
Just a little longer.
That was kind of a,
People,
when you said it,
It's true.
it suddenly resonated. I didn't find out until my mom was sick 2.5 years ago and in a nursing home at the time before she passed. And talking, I did not realize until I was interacting with one of the nurses, and she continued to refer to my mother as, elderly, the very elderly. And I thought, wait a minute, my mother is not elderly.
Yeah.
She's like, no, your mother is elderly. You're old. And so even when you said, so even when you were saying now, when you gave that age as a threshold, these are things that really need to be hot and heavy on my mind. I'm thinking in terms of how to manage my dad, who is still alive. But I'm thinking these are things that I'm going to need for myself. And there's a way that I'm used to looking for things, what you've described as the Pearl platform is something that's very attractive to me.
Yes, it's going to be the new wave. I'm convinced of that, because both Carolyn and I and you have had to serve in that caregiver role substantially and interface with skilled facilities and personnel. And so you brought out something to mind. Are you seeing, in terms of the COVID and the impact, the concern is what's happening? What are you hearing through your network? What's happening to those individuals, those would-be residents? Where are they going if that's the case? Because many of these facilities are last resort for families.
Yeah. So what you see is a cobbling together of family caregiving, some home healthcare aides. The bigger problem is that people are it's not affordable. So even people who come to need additional care, many of them can't afford it. The average for a daily rate and across this country for skilled nursing is $280 a day.
Yeah.
Most seniors don't have that much money in the bank. And the average stay is getting longer because people are living longer. So on average, people are staying 835 days. That is about $233,000 at the end of life that on average people are needing. And there are many seniors who don't have that. And so you're seeing, family members spread thin to help take care of their loved ones. Home healthcare workers brought in to supplement family members. And the family caregiving structure is eroding because what you see is, smaller numbers of children from baby boomers and children that are geographically separated from their parents and can't provide that care. And so this is really, the makings of a crisis if there isn't something that changes to increase access and affordability to seniors who come to need this care.
Tell us a little bit about that policy that you've worked in that space, because I have long-term care insurance. I already know it won't even cover, it will cover probably about 50% of that number. And that's a pretty hefty policy. Can you share a little bit about policy-wise as we walk into the next, I think, 6 months, kind of part 2.0 COVID-19?
Well, one of the things I think is really great when you think about health policy is that we're in election year. And so there are all these proposals about reimagining Medicare and Medicaid. And so there's a unique opportunity for us to have our voices heard, to talk to these candidates about reimagining Medicare. Right now, Medicare does not include the coverage of long-term care except for when it's a rehabilitative purpose. So think, I use Medicare to get my hip replaced or my knee replacement. And up to 100 days, Medicare will cover up to 100 days for our rehabilitation. But when you talk about 835 days on average, that leaves a huge gap for families to fill. And to your point about long-term care insurance, only 10% of seniors 65 and older have long-term care insurance. What we've seen in the industry is a complete you went from, over 50 long-term care insurance providers in the early 2000s to now there's less than 10 that are offering these policies. And what you're seeing is the coverage itself is not keeping pace with the increasing cost of this care.
Yeah.
So like you mentioned, Linda, what happens is you bought into this long-term care insurance plan when you were young. You've paid continual premiums every year. Hopefully those premiums aren't going up, but most likely they are as you age. And you locked in a certain benefit up to a certain amount per day. And what happens is that number is likely to be less than the compound annual growth rate that year over year, these services are increasing in cost. And so you have that gap. Most people have about $150 a day if the baby boomers, because they bought earlier. And like I said, the average per day is $280. Who's going to make that? Who's going to pay that? Fall on family caregivers. It's going to fall, the children. What we had to do was get rid of some of my grandmother's most valuable assets to help her.
Yeah.
And we talk about dignity. You've worked your whole life to get a home, to have your assets, and to have that be at risk because of the last few years of your life you need care is really robbing our seniors of the dignity that they should have in the sunset of their lives.
Wow. So when you're up and running full tilt, sometime during the first quarter of next year,
yeah,
I'm going to be looking for you hot and heavy.
We'll be ready.
Just as a consumer, is this something that I subscribe to? How do I get access to you?
You come on to pearlltc.com and basically you'll be able to, there's an interface that's really simple. It looks like Expedia or Priceline, so that you're familiar. And like I said, we focus on ease of use. So essentially you log on. We don't require any information from you up front for you to look at or explore options that are available to you. So you're able to, just like you would on hotels.com,
right,
where you want to stay, when you want that stay to start, what level of care you think. If you don't know the level of care, we have a questionnaire that will help you figure out what level of care is appropriate, whether you want this to be a short-term or a long-term stay. And then you could search by all of that, your budget, most importantly, your budget. You get to put in there some numbers around what is the max amount that you can afford each month for this stay. And then you're given near real-time availability of facilities that meet your criteria. And then you're able to go in at the facility level and see floor plans, see the care team that will take care of you. And so at that point, it makes a lot of sense for consumers to sign up for an account, because if you want to save properties and share with your family, share with your loved one, we provide that opportunity for that care coordination to happen right on our platform. You're able to upload all the documents that are needed from the facility to finalize the booking. You're able to book in real time on our platform. But what we're really excited about is the bidding option. The reality is that year over year, unoccupancy across the industry is around 10%. And so those are beds that are empty, but they're cost centers to operators. And so what we're hoping is that, if a provider can at least get their marginal cost, the cost that it takes to heat and cool the room, to stay in regulatory compliance, to have the right staffing, that they'd be willing to accept a rate that's a little bit lower and that a consumer can take advantage. We're creating both provider value and consumer value in that meet in the middle ground. Like maybe the family couldn't afford the rack rate that you get if you walked off the street, but the bid allows the provider to accept a lower cost and to allow a family to price in or be able to afford that care. So
can I say, can we just give you a clap on that? Can we just give you a clap on that? Because I know exactly what you mean. If you are not, some of us, Carolyn and you and myself really have individuals that we know how to negotiate. And we just ask the questions because you always get to know if you don't ask the question.
That's right.
And then we find out some of these are negotiable because the vacancy rate is so high. And we appreciate the fact that that is a feature that will be available. And I think it's going to work out very, very well. So can you share with us a little bit about what you're hearing as it relates to the providers? their thought process and plugging in, because we know that you have your nurse navigators, your social workers, your all the initials, and being able to help their patients, their patient navigators, to plug into something just like this. And particularly right now in COVID-19, where it's still so confusing for a lot of families.
So we see, the provider dashboard that we're creating will really allow for providers to have an inventory management tool so that they can see all of their available units across their facilities and manage families that are in the queue. What we're seeing, to your point, there's a lot of turnover as it relates to staffing in this industry. And what we believe we're doing is creating a streamlined solution that will free up the providers to take care of the most important part of this, which is the seniors. And so if they can, depend on Pearl to help them fill their empty beds, they can focus more on the resident experience, coordinating with the family, making sure that the care that they provide is quality and affords a quality lifestyle to seniors when they come to need this care.
So let me ask you this, sorry, Linda. When you're thinking about this, this is an incredibly heavy lift.
Yeah.
How big will the Pearl team be? We know at rollout you're anticipating certain things, but is this going to be regional? Is it national? Is it global? How far will your reach be, and what will your team look like?
Yeah, so we're definitely going to be national, and we have plans to go global. What we're seeing globally is it's not much different than what we're seeing in the United States. Baby boomers across the world are aging. Right now, in 2014, the date for when this is available, there were about 868 million seniors over 60 in the world. That number will grow to 2.02 billion by 2050. So clearly, the world is getting is getting more silver, is graying, and we're going to need these services. You're seeing in economies like Brazil, Japan, China, Italy, that they're rapidly aging, and the number of seniors is going to grow precipitously from between now and the next 20 to 30 years. And so we're going to need workforce. So we talk about, there's a lot of turnover, but there's going to be a lot of opportunity for people to step in and to provide this level of, the care and coordination at the facility level. So if I were still in school, I'd be thinking about that as an opportunity, a workforce development opportunity as well.
That's interesting that you said workforce development, because of the connectivity to the patient and family experience. I love the way you mentioned that, because that is a critical part of the care once that family member is entrusted to that facility. During COVID, have you seen any trendings that we need to be mindful of? Our listeners and our viewers, what should they do? How do they create a better opportunity for that patient care, that family care experience? We know that we've seen lots and lots of families who are looking at their loved ones through windows, but do we know anything else that we can do? Can you provide any insight to what you're hearing on the ground?
Yeah, so there's been, luckily, COVID has kind of thrown industry players into uncharted territories as it relates to coordinating that, kind of touch with families and making sure that seniors aren't lonely and depressed because they're not able to receive. And so we've seen some innovation in the field around, making some AI around helping robots and different types of innovations that are brought in to keep moving, to keep them active, make sure they're making those connections, using technology like the technology we're using today, like Zoom, so that seniors can see their loved ones and spend time and, plan time for family gatherings. Those things that were happening, organically with family members who come visit. As I said, the doors are closed to outside visitors for the most part, and it's for safety purposes.
Yeah.
You're seeing a lot of innovation, I think digital innovation across the industry. And while it doesn't replace human touch or feel or seeing somebody, at least, you're starting to see the providers begin to try different technologies to meet those needs.
So you started, I'm sorry, when did you start to work towards this Pearl project, this new company?
So the idea was planted in 2018. And, with the startup, it takes a while to get some traction and build your team. We've had a few pivots, of the idea and refinement of the idea. But it's been a labor of love for me because this is, I talk to my kids a lot about legacy. And for them to have known my grandmother Pearl and to connect what I'm doing and what my team is doing through to really just have the legacy of both of the Pearls live on through what we're doing.
That is
Wow.
outstanding.
It really is. So here you are in a COVID climate, which really all it does is amplify everything you've said as a reason why we need this long-term care solution. And you're having to do it in the midst of our first ever global pandemic that any of us can remember.
Yeah. Well, it's really created the perfect case study for us, right?
Yes.
Okay.
Yes, it has.
It really proved that this is something that the industry should have been, kind of moving towards anyway. Right before COVID, what would happen is, maybe you got a lead from somebody, a referral agent or something like that. They give you a list of facilities that they've contracted with, not even a list of facilities that was exhaustive that you can go to. And you can go to those facilities. Not all of them are guaranteed to fit in your budget. Not all of them are guaranteed or to have a bed available or your care level available. So you're going down this list, taking lots of time to do it. And then there is no common kind of admission process. So if you're looking at, this long-term facility over here and that one over there, you have to fill out paperwork at both places. They may look similar, but not exactly. This one may require that one may require this. And so there's been no kind of commonality. And that's what Pearl is hoping to bring to really streamline the process for consumers and help that. So COVID, because these sales and marketing kind of their infrastructure, even though it was manual, it couldn't happen. It could not happen. And so what you're seeing across the industry is where the average was 10% across the industry of occupancy rate, that has gone to its lowest in the last 14 years since COVID has hit. Because as people move out or pass on, those beds are not getting filled because there's no infrastructure built there. And so we're hoping to be that solution to providers in this difficult time.
Well, that sounds like a very important way to not only participate in the economy, we call it the pandemic economy, but actually provide a critical service that's going to live well beyond our current economic crises, because it touches so many people in the supply chain of elder care management, from just the moment of a health need all the way through to every single provider that moves forward. We have just a few more minutes.
So as we're wrapping up, and we know we're going to hear from some other phenomenal people connected with your organization next week, but how can people contact you and find out more about this? What can you give us some contact information?
Yeah, so our website is www.pearltcsolutions.com. You can also call us at 844-MY-PEARL. And also email info@pearltc.com. We're here 24 hours a day to help you. Even if you have questions or want some help before our platform's live, again, we're here to ease the search and selection, and we'll do anything we can to help folks on that end. This is not a business proposition. This is personal for me.
Wow.
Yeah.
That gives me chills.
It does. It just gave me chills because it is extremely personal. And all of us who have been caregivers applaud your creativity, your innovation, and really your team's forward-thinking solution development. Because when you talk about you said 0.5 billion by the
2.02 billion. Yep.
Wow.
2.02 billion by the year 2050.
Yeah.
That is staggering. And
It really is.
We're going to have so much more conversation with you as we go forward, and next week with members of your team to talk
Exactly.
to expand the conversation, because this is a critical cornerstone to our society.
And then once you're up and running, we're
Mhm.
going to absolutely circle back
Yes.
with you in 2021 to see how it's going, because this is super exciting for us. We're not only going to be your supporters, we're likely going to be your clients as well.
At some point.
So we are really, we're grateful to you for being on today. We will follow you on your social media platforms that exist, but we'll definitely reach out to your website, www.pearlltcsolutions.com.
Yes, that's right.
Wonderful. Thank you so much, Maisha, for being here.
Having me. And
Thank
to hear all that you're doing. Thank you for that too. Innovation lives on through you guys as well.
Awesome. So
Appreciate it.
we're going to transition back to the U.S. Virgin Islands. And
Small business is a part of all of us each and every day. It's where we eat, it's where we shop, it's where we go to meet our friends and colleagues. In the wake of COVID-19, our small business community desperately needs our help. We must do our part to help our local communities to once again thrive. We must focus our attention on the small businesses that are the fabric of our great nation. SureUp is a network of small business owners, their employees, and local consumers all working in unison to support each other. By creating incentives for consumers to think local before considering regional and national providers to fulfill their needs, we create local job opportunities and rebuild our communities. In addition, through AI-driven tools and machine learning, in just 5 minutes a day, SureUp assists business owners in improving their social media presence, which enhances their visibility among consumers and levels the playing field so that local businesses can better compete with large, name-brand online competitors. When local businesses leverage the SureUp platform, full-time and part-time employees, whether W-2 or 1099, are rewarded with a variety of voluntary perks and member benefit options. These include discounts on the things people do every day, access to low-cost, subscription-based telehealth and teletherapy, discounted prescription drug plans, connection to exclusive Prosper resources, and so much more. All for less than the cost of a cup of coffee each day. The JumpStart Marketplace is here to support the health and wellness of individual employees, as well as the health of businesses in the local communities in which we live and work. We're all in this together, so join us as we reinvigorate our local community and improve the physical and financial health of working America.
Hello.
Hi,
So
hey
you're
Terry, how you
listening
doing?
to the first set of my marketplace, and I'm so happy we're going to be joined today by Ambassador Sujay. So I hope you're going to
Can you hear
enjoy
me?
this segment as we jumpstart the economy. Ambassador Sujay, I see is coming on now. You're sure in for
Hope you're well. I can't hear you. I hope you can hear me. Okay, you're frozen. I can't hear you.
Hi, Ambassador.
Yes.
Hi, you can't hear Terry?
No, she's frozen on my screen. I can't hear her, and there's no movement. That's why I was doing like this to make sure it wasn't me frozen.
Okay. I guess she's going to have to try to call back in. What I'll do in the meantime, while she tries to log back in, let you and I just continue the conversation.
Okay.
Until she calls in. So, Ambassador, thank you so much for being part of the broadcast this afternoon. And we are broadcasting live from the Fred Hotel here on St. Croix. We're broadcasting live from the hotel. And so we're really excited about having you on.
Okay, I just lost your volume too. I'm sorry. Can you hear me? Yours was going in and out, and now there's nothing. So I'm so sorry. Can you hear me at all? Okay. I can't hear. Can you hear me at all? Can't hear you. Okay, I think I'm live, so I'll just talk until we get the others. I'm Ambassador Susan Johnson Cook, and I'm coming to you from New York and Washington, D.C., and it's just a joy to be here on the show with Terry and my good friend Terry Coxum, who is all about business. So let me just introduce myself to you. I am the CEO and founder of Charisma Speakers, which is the first global professional speakers bureau owned by a woman. We do consulting and coaching. And I also now run the Global Black Women's Chamber of Commerce. So I think we're getting Terry back on, but I wanted to just say hello to all of you. Hi, Terry.
Hi, Ambassador Sujay. Sorry for the technical difficulties, but I know that you are Wonder Woman. So you're able to come on and introduce yourself. I appreciate that. Thank you so much.
You're welcome.
Everyone, you are truly in for a treat today. Like as Ambassador Sujay says, she is the founder of this first chamber. And so that's what we're going to talk about. We're talking about jumpstarting the economy. Sujay is also, well, Ambassador Sujay, for Sujay for short, Ambassador, I'm sure you don't mind me referring to you as Sujay. But for our listening audience, Ambassador Sujay, she was the ambassador to religious freedom, first African-American woman under President Obama. She was also the faith-based action leader for President Clinton. So she served two of our wonderful presidents. And she also is the third generation business owner. And so, yeah, so she'll be able to talk to us about some of our business woes. We're looking forward to her talking about some of the barriers, the best practices, and big ideas. And more importantly, we want her to talk about the Black Chamber, the Women's Black Chamber that she started. So thank you again, Dr. Sujay, for being a part of this Jumpstart the Economy. When I came in, I heard you talking about the different areas that you are servicing in the New York area, of course, in Washington, D.C. I want you to talk a little bit about the chamber and how you guys are ready, willing, and able to help jumpstart the economy in the region.
Thank you. Well, first, let me say thank you for having me, and thank you for being a friend, because I think part of jumpstarting anything, whether it's the ambassadorship, is that you have to have relationships. And one of those great ones was with you, not past tense.
Thank you.
I want to say thank you for your support and connecting. And so the Global Black Women's Chamber of Commerce is about connections, collaboration, and creations of Black women-owned businesses, because we were the fastest growing in the United States economy. And so what we want to make sure is that we're not the fastest that are closing, but that we help businesses sustain and even scale to be able to grow. So we just started, and the difference with us is that we focus solely on Black women-owned businesses and globally or worldwide. So we want to be able to do trade with sisters in St. Croix and in Africa and bring the whole diaspora together, because I've learned that 1 and 1 equals 2, except when it's side by side, then it equals 11. And so we're trying to have the multiplying effect. And that's what jumpstarts economies. The other thing is that so many candidates in the U.S. were campaigning about how they wanted to close the wealth gap. And we want to make sure that we are doing multi-generational wealth creation. And so what we're beginning to do is not only help businesses that are already in place, but we just created 25 Black women-owned distributorships.
Really?
And yes, we had a partnership. This is our pre-launch project. We partnered with a company called EBW, Empowering a Billion Women, and they do PPE equipment. They have.
Oh, wow.
And so we just trained 25 women who will have their own distributorship, and they'll be ready to go out immediately as schools are opening and as hospitals and medical places are saying they're short on supplies. We're going to say, buy it from a she. It's called She for PPE.
Oh, wow. Okay.
So we're excited. So we want other businesses to come in. You can come in as an individual, as a small business, or as a large business. Our website is globalblackwomencc.org.
Nice. So that's, first of all, that's really phenomenal. I commend you on that, especially in our district. We've been having a lot of shortage on the PPE equipment for the chamber to have these women-owned businesses, minority-owned businesses be a part of the distribution is truly a phenomenal thing, and that's how we jumpstart our economy, right?
Exactly.
By putting the dollars.
Several from the New York area, because we're global. There are women from everywhere. We have some Brooklyn women in the house, and
all right, Brooklyn.
Women in the house. So it is phenomenal, and so when people use that word pivot after COVID, it means change the way you were doing business, but it doesn't mean stop doing business. And so for my speakers bureau, I used to do in-person speaking. Now I've done viral and digital speaking. And so it's a matter of seizing the moment, not being squeezed by the moment, and being able to pivot and go places you've never gone before and do things you've never done before. So with the collective of a chamber, we have like 70 women who joined in the last 10 weeks. So we now have a collective, almost like a union, of women-owned businesses that say we're ready and we're open for business.
You know, that's great, because in our last segment, we were talking a little bit about just readjusting, pivoting. We talked about it with the restaurant industry. We actually had an opportunity to talk to a coffee shop owner in the Virgin Islands, and she was telling us some of the changes that she had to make as a result of COVID. And then we were talking about restaurants here in New York, in New Jersey, and Connecticut, where they have like that outside seating arrangement where individuals are able to come in and to dine, and they have to, they're properly social distancing, and there's the mask is worn and all of those things. So when you're talking about pivot as we jumpstart the economy, I think that's phenomenal. One of the questions I was asked on one of our segments was about the digital age, using computers, because that was one of the main things that my restaurants had to adjust to, right? So they had to now have a better online presence. They had to now have the opportunity to have some sort of delivery service so that they could deliver. They had to now look into catering options that they hadn't traditionally been used to. And so that was their way to diversify their business and to be able to quote unquote pivot, right? So it's great that you're talking about that pivot. Now, what would you say? Because I know now you're dealing, and with the chambers, you have a lot of different businesses that you're working with now. What would you say?
Too, which is the other piece. So we have some Gen Zers and millennials who are teaching us some things about the kind of apps that we need to use and the marketing that will attract that generation. I'm a boomer, and so you're a little younger than me, but so we do things differently. I mean, computers just came out when we were graduating from college and grad school.
Mm-hmm.
Generation is growing up on them. So they were like, if you want to get the millennial generation, these are some things you have to do. You got to make it shorter. You have to make it more attractive. And you got to come to the places where we are on in terms of the web presence. Yeah.
Right. And that's exactly what I wanted you to share. Because you have to meet people where they are, especially with COVID, right?
Mm-hmm.
You have to meet them where they are with the technology. The technology exists, but you also have to be able to get out there and attract your audience. It's a different marketing, like you just said, that app. There's something called an app, and I had to get businesses to realize the app can be your friend, right?
Exactly.
So that's great. Now, one of the other things I want to talk about, we talk about jumpstart the economy. We talked about SBA and monies available through the EIDL loan and through P3. Did you find that any of that was helpful with your businesses that in your chamber, or what are some other things that you think the government can do to jumpstart the economy at this point?
So let me say that the chamber was birthed a week before COVID hit.
Oh, wow.
A lot of the monies, we didn't focus on the monies. We looked at grants that were available rather than loans.
Mm-hmm.
We looked at, we were further down the road than when these monies were announced. For my personal business, which is a speakers bureau, the EIDL money was very, very helpful to really make sure that we didn't shut. And P333, you really have to be positioned in a way to have a number of employees where it will be beneficial to you. But it brings me to the point of knowing your numbers and what we call financial forecasting. I do what we call Live with Sujay, and we just have as our guest M. Gatsby Brown. She used to be Gatsby Greeley in New York, and she now runs the Gatsby Group, which helps with nonprofits and for-profits. And the one thing you have to know is your financial piece, knowing how to file your paperwork, and making sure that's accurate. Because had you not done that, none of those monies will be available to you. You want to make sure you have your EIN number and have a bank account and to have all the basics in place. So I would say if you haven't had all of those things in place, the best thing at this time to use COVID to get your business on its feet.
That's right.
To get it in order, as our old people used to say.
Yeah.
Put your house in order, because there are monies that are available. I tend to like grants because that means you're really giving me an opportunity without a strain to pay you back.
Right.
You're giving me an opportunity to really jump and to leap. And so that's what I would want to do. So I encourage people, the other thing I encourage people to do is to keep growing. Read the fine print. Sometimes a loan is good for you. Sometimes a grant's good for you. But the bottom line is businesses are businesses to make profit. So
That's
you
right.
constantly invest in yourself. So I went to a couple of courses for executive business programs, one at Howard University and one at Dartmouth College, Tuck Business School, because you want to make sure that you're constantly investing, strategically planning, and also knowing your numbers. So I have the principles I call it the D-SMOG principles. Smog is when fog and haze all come together and you really can't see.
Right.
These SMOG principles are you have to digitize, energize, strategize, monetize, organize, globalize, and glamorize.
All right now.
All right.
Repeat that one more time. Digitize,
energize, strategize, monetize, organize, globalize, and glamorize. And it's trademarked. It's the D-SMOG principles. but it's about really having a plan of action. You can't just wake up and say, I have this great idea, I'm passionate about it. No, you're talking about it's hard work, whether it's nonprofit or for-profit, you have to do the work to get the results that you need.
Absolutely. You've given us a lot of nuggets today, actually. One of the things that you started off talking about the support, the global, your global chambers is offering the support that businesses need to quote unquote pivot, right? So you started talking about the support. So one of the things that I'm walking away with, and I hope that our audience also get from this, is that support. You need a support system in place in order to be able to move forward, especially in the pandemic. The second thing that you gave us was that financial piece. And a lot of times as small business owners, we get so stuck running our business that we're not looking at our numbers. We're not looking at our bank statements. We're not investing back into that business. And I think that that is really important because like you indicated, in order to be able to get any of the monies that the government had available, you had to show them your tax returns. You had to have a bank account. You had to have your EIN number. They had to know that you were paying a payroll. So you had a payroll company in place. So all of those things, what I would encourage small businesses to take away from that in addition is you need a lawyer, you need an accountant. And those are two main things that you need in your business. You can't be the chief cook, bottle washer, and candlestick maker because you won't be successful. And then the third thing that you gave us, in addition to that, was the DSMOG principles, right? So, we're going to digitize, energize, strategize, monetize, organize, and globalize. And so I want to thank you so much for giving us so many nuggets today. And I hope that you'll consider coming back on to be on the show. I know today we had a little bit of technical difficulties, but hopefully you'll really consider coming back on the show. But before we come to an end, we have a few more minutes left. I want to take away from you. I want you to you gave us all the strategies that we need to be successful and to jumpstart the economy. And so, like I said before, you're a 3-generational business owner. And so we've talked about a little bit about some of the barriers that small businesses face, and you've given them some tools and nuggets to be able to get through some of those barriers. And so if you could start again in your business, what would be some of the things that you would want to leave with our audience today to make sure that they're on a level platform to be able to quote unquote pivot or get to that next level?
And I know you're almost out of time, so I will say a couple of things. One is to stay in touch with you and with me.
All right.
We can't do it all, but we can provide resources, opportunities, and networking. And I think that's what's important. You have to have relationships, and you have to have a network of supporters and people who are at your level. I think one of the attractive pieces to the chamber was people were like, finally, I can sit down with people who are going through what I'm going through, so we can exchange ideas. And you do learn from other people who've done the very thing you're trying to do, and vice versa. So relationships, whether you're going into the business of politics or the business of the restaurant business or even the business of church business or show business, all of the businesses require relationships. It's who you know that can open the door. But when the door is opened, you have to be ready to walk through. And that means being prepared, making sure your digits are in order, making sure that you have 6 months to a year of salary to live off of. It doesn't rush in right away. And you don't want to cripple yourself. And finally, work-life balance. I would say, no matter what, set boundaries for yourself. I burned out my first part of my career because I didn't know about office hours and all that. And I let people get all of me all of the time. So in learning that, I wrote a book, Too Blessed to Be Stressed, Words of Wisdom for Women on the Move.
That's right.
On Amazon, but it's about scriptural steps to bouncing back from burnout. And almost everyone who joined the chamber is a woman of faith. And so it's faith that undergirds us. Have someone, something to lean on. And for us, it's been that faith that's been the grounding so that we can go to the highest mountains. And if we fall into the valleys, we still can hold on. So I would say those are the things I would give to you.
Awesome, awesome. Dr. Sujay, you are a phenomenal woman. She has several books out. I read Too Blessed to Be Stressed, and she has several other books. And I encourage you, please, follow her. She has a Wednesday, and we didn't get to mention it, but one of the things that when I was in the Wall Street area, I had a great opportunity to go to the midday service with Dr. Sujay, the lunch hour, the power lunch hour. And you would go in and you get poured back into, and then you can go back out into the corporate world, into the government. And so I want to thank you for always being that go-to. And to the listening audience, look up Reverend Dr. Susan Johnson Cook, Dr. Sujay. She's doing some wonderful things. Look and see what she's doing with the chamber now, because she is a forward thinker and a change agent. So she is always ready, willing, and able to take on that next thing to be able to empower and encourage. So Dr. Sujay, thanks again for being a part of this Jumpstart, and I look forward to having you back on again. Thank you so much, Dr. Sujay. That's right. Thank you. Thank you, Dr. Sujay.